Hello, my name is Amy Delaney, and I'm currently a second year student at the CU DPT program. For this video, I'm recording any answers and questions for the opportunity of the CE3 clinical rotation at the medical services at the Wardenburg Health Center. In this recording, I'm going to be asking the questions that were provided within a previous email, as well as answering those questions. Question 1 states, describe your greatest workplace strength, something you rely on daily when treating patients. Something that I rely on daily when treating patients is the principle of adaptability. In order for us to be effective, I do believe in coming in with a plan, making sure that we've done a chart review, making sure if it's a follow-up appointment, that we've asked our due diligence and any subjective questions which would rule out red flags. I also believe that patients and their response to treatment is incredibly individualized. So some patients may adapt faster to our treatment modalities and our intervention programs. And in order for us to meet them where they're at, we have to demonstrate a principle of adaptability as well. I also believe that patients and their response to treatment and therapy sessions may depend on not just the treatment we provide, but the physical environment around them. So, for patients, if they're not demonstrating the same level of performance as they have in previous sessions, or they seem more distant, their affect is a little different. I think that our ability as clinicians to adapt to those factors and to meet them where they're at provides them with a stronger therapeutic alliance, as well as can have improved patient outcomes and generally a greater rapport in order for them to feel as though every time we see them is an important time. Every session that we see them is a new session, and that we're excited to see them there and we're excited to see their progress. Question 2 states, how would you handle this situation? Your patient arrives at the follow-up appointment, you bring them back to a treatment table in our gym, and they start crying. So first and foremost, I would ensure that it's the most private area possible in order for the patient to feel that what they can say in confidence, and that they are in a protective space and a safe space. I would then let them know and acknowledge, I see that you feel upset right now. Let's take a moment, and then I may have some follow-up questions. I think that allowing them time and space to process with what they're navigating is important rather than barraging them with questions or asking them to acknowledge me and see what I want them to do. In order for them to feel safe and feel comfortable, I think that giving them that space is incredibly important. During those questions, I would also reinforce to them that the questions are of a nature for me to prioritize first and foremost their health and their happiness and their safety. If at any point during our conversation, some of the questions raised concerns about their health or about their safety, and we needed to involve either a referral or other entities at that point, I would also get my CI and fill them in on the situation and genuinely ask for any advice or guidance in moving forward, and reiterate to the patient that it's because we value them and we value their health, and we genuinely want them to feel safe and healthier and happier. And to have the best outcomes possible, we need to make sure that they're in a safe space for that. Question 3, how would you handle this situation? Your patient comes in flustered because they could not find parking. Then they misunderstood how to check in on the computer and got into a spat with the front office manager, making them late for their appointment. I think we have all had those days. And I would acknowledge to the patient, this situation seems frustrating, and I can see how this would make you frustrated. I would also acknowledge to them that at any given point along the path of them coming to their appointment, they could have walked away. And I would tell them thank you. And I have a lot of gratitude for them prioritizing their health, prioritizing treatment, and prioritizing physical therapy at that point. Because in order for them to go through the dynamics and to go through the hoops in order to get to their treatment today, it says that it's important to them, and I appreciate that it's important and it's important to me. I would then reiterate to them, with the time that we have available, they can have a choice and an option to do this warm up in this exercise or this warm up in this exercise. What is the most important to them with the time available with the session that's left? Just because that's how the session started, I don't believe that's how the session has to progress or end. And this is their time. This is their time for their health and their wellness and their goals. So by giving them choice and by giving them options, I think it also gives them autonomy to say, for my treatment, for my time, for what I have today, this is something that I feel comfortable doing, especially with the environmental factors that I've been navigating. I think that giving individuals options and choices is something that we can do as providers to build stronger relationships and for them to want to come back for their next session as well and to continue to prioritize their health. Question 4. Tell us about a time you built a therapeutic alliance with a patient that originally started out as a difficult relationship. In one of my previous clinical rotations, there was an individual who had been coming to the clinic on and off for about a year and a half, and they had actually developed a really strong relationship with both the clinic and my CI. And at the point at which we met him, and I said, "Hi, I'm Amy. I'm going to be with you for your future treatment sessions, if that's okay with you." He notified my CI and I that he was not interested in receiving treatment from an individual who either had an accent or did not speak English as their first language. I did acknowledge to the patient that this is important and that their values and how they can feel safe within a treatment session or the clinic is incredibly important to us. Even though English is the first and only language that I speak, if he would feel more comfortable and be able to trust the process with another provider, we at the clinic had the flexibility to put him with another provider and to have a therapist be paired with him in order to try to meet his future goals within the sessions. And honestly, I think that us acknowledging that this was important to him and that we heard that it was important to him and that we at the clinic could value that in order for him to feel safe and to be able to trust what we're doing here at therapy, that we were willing to adapt and to be flexible. And just hearing that, he said, "Okay, well, I'll give it a try. We'll see how it goes." And for the next 6 weeks, it was actually really great. We got through a lot of treatment, and he was able to make some pretty good progression on his goals. And we, I think, had a really strong rapport together towards the end of that experience. So I think that it was an experience that taught me the first impression does not have to be the last impression, but what people say, if they're willing to say it and they're willing to voice it, it's important enough to hear. And at the end of the day, I think that our willingness to be flexible and our willingness to meet him where he was at enabled him to have more trust with us initially and then have some really great outcomes out of that. Question 5. How would you approach your CI if they were providing a type of treatment that you know has conflicting evidence on its effectiveness? First and foremost, I would make sure that we were in a private space. I would never approach my CI in front of a patient. And I would communicate to my CI if there was time built into the schedule throughout the week, would it be possible for us to talk about that treatment modality and how they have seen its efficacy and its outcomes with patients? For evidence-based practice, for the three pillars of best available evidence, patient values, and clinical expertise, I can find information through CPGs. I can find information through articles. I can have conversations with patients on what their values are and what they think is their progression and how it's going for them. Clinical expertise of someone who has seen the effectiveness of treatments and the outcomes of treatments and how those treatments impact patient values for 10 years or 15 years. I currently, as a student, do not have that. That is the most underdeveloped part of evidence-based practice for me. And if the clinician and if the CI was willing to have that conversation, honestly, what they would be able to provide for me is a gift because that is something that I can't I can't find, I can't Google, there's no CPG on it. And then I would also ask them, based on how they've seen it translated in the clinic, how do they reconcile that with the available evidence, or if they feel like there's a lack of evidence in that arena and what we can do to research better or practice better or bring more dynamic input to this process and how we can really find the best outcomes for our patients by using all three of those principles. if they were willing and open to that. If not, they earn their clinical expertise for those 10 years or 15 years. And I would be genuinely thrilled to be able to have any part of that. Question 6. What brings you joy at work or in the clinic? Honestly, what brings me joy in the clinic is a strong team atmosphere and a team that has a strong identity. I think that we as people and as physical therapists and as clinicians, we have a very unique space within our ability to spend time with our patients and to spend time even with one another and to say, this is what I saw. Is this something you've seen? Or this is what I'm trying right now. Is this something that you've tried as well? And I think that having strong mentorship and a strong team identity and a team culture translates to better patient outcomes because there's more communication. It brings me joy to be around people who have passion, and it brings me joy to be around people that they don't have to do this, they get to do this. And this is something that, given the opportunity, I would love. I would love to get to do this. And that brings me joy, the opportunity and the challenge and the ability to meet patients and to experience their journey with them and support them through that journey gives me a lot of joy with people who have passion. So thank you so much for listening to my answers today and taking the time to watch my video. And I look forward to hopefully hearing from you soon. Bye.